them to doing adult care. And this mom is what I would call a helicopter parent. When kids are very young, under the age of 5, they're really too young to use a mouthpiece to do their nebulizer, and the mask is a much more effective way of doing it rather than blow by, because kids breathe through their nose. As they get older and they can coordinate breathing through their mouth, the mouthpiece is a much more direct way of getting the aerosol into the lungs. So we really recommend that. A lot of kids who want to use the mask when they're this old are usually wanting to because they don't want to concentrate on doing the nebulizer and the treatment. They want to concentrate on their computer game or their other distractions. And I'm not saying that distractions during treatments aren't a good idea. You have to have a way to make the treatment a little more enjoyable, but there has to be a compromise where the kids are paying attention to what they're doing, but still not bored to death. So this patient should be using a mouthpiece, and she should definitely be holding her nebulizer herself. But what a nice mom. So I thought this was a stellar picture of a nice kid. He obviously is used to doing the mask. He's sitting in the chair, he's sitting upright, he has his vest going, he's watching a video probably, but he's taking an active role in his treatment. He's awake, he's sitting up. That's a good way to do a treatment. And I like this picture too because this kid is holding the nebulizer himself. He's holding the mask up to his nose. He's not screaming or crying. He's not throwing a fit, and he's getting a good nebulizer treatment. So I want to talk a little bit about what you do after the airway clearance. Loosening up the mucus with the vest or the chest physiotherapy is one thing, but in order to clear the airways, you have to get the mucus out of the airways. So how are we going to do that? Well, the way we do this is by controlling our coughing. Now, when we're trying to remove secretions, the most natural thing is to take a huge breath in and to cough very hard. Well, a lot of times what that does is a violent cough really makes the airways collapse and the mucus doesn't really go anywhere. So a lot of times you'll notice that when we're in clinic and I'm trying to help kids cough secretions out and spit them into the cup for a sample, that I show them to actually take big breaths and try and release the air quickly without closing their glottis or coughing, and that's called huffing. I think the next slide will show that. So in order to do that, you take a big breath in and you blow the air out like you're fogging a mirror. You don't try and cough, but what that does is it helps move the secretions along so that you can help to get them up high enough to cough them out easily without having to force your cough. And a lot of times I'll talk to parents who say, well, my child just doesn't have an urge to cough. And my answer to that is, I think that when you're doing the airway clearance, part of doing the treatment is taking a break every few minutes to try and make secretions come out, because they are in there. And they're sticking in there because they're sticky and they're thick. So the kids have to kind of force themselves to do it, and I advocate for that. And I know it's very difficult to try and push people to cough and do huffing when they feel like there's nothing there, but it is an important thing to do. Exercise helps airway clearance, but we don't like to do exercise instead of airway clearance. What we advocate is that children get good airway clearance and get exercise, because everybody needs exercise. And it especially helps with CF patients to help get the mucus moving, because you're breathing hard, that's a form of airway clearance on its own, taking breaths in and blowing the air out quickly like you do when you're running or moving around. Really helps to get the mucus moving. So regular exercise has a lot of benefits in CF, and one of the biggest benefits is it really helps to increase your endurance and your ability to live a happy, productive life when you're exercising. A lot of people that have CF feel like they shouldn't exercise because it makes it hard for them to breathe, but really what they need to do is they need to exercise so that their endurance is built up and they can breathe better. So my take-home point is that learning how to manage your child's health problems with their lungs is going to, in turn, maintain the best lung function possible for the longest amount of time. It will help to reduce the number of infections that a child gets, because if there's less mucus in their lungs, there's less mucus to get infected. And that it will balance, it's important to balance your CF care with your family's quality of life. You have to, it's important to get everything in. We don't want to make, I always try and tell families that the important thing is to control CF, not let CF control you. And that's it. Do you have any questions? You can always contact me at the CF Center, and I'd be happy to pass on any information or to help you with any questions you might have. Help you get equipment you need to do airway clearance. Help you get equipment to make your vests work better. Whatever it takes, I'm there to help with all those things. So please contact me. Thanks.
Thank you, Kristin. I love the practical tips. And to close the session, we're going to have a duo tag team type of presentation. Julie Mattel and Jackie Sirvis are going to bring us up to date in terms of infant and newborn nutrition with CF.
I don't think I actually read these. No, I took that one. She said they were loaded.
Do you have a memory stick? That's not the one.
I do. It's over. It's in the bag.
I get the memory stick.
I guess they're not loaded. I have the memory. Okay, that's good enough.
And